Good morning, everyone. My topic for today is pediatric ocular firecracker injuries. The purpose of this study is to delve deeper into two cases recorded during DEEPAVALI, who availed the emergency eye care services of our center to highlight the role of firecrackers as a case of ocular injuries in firecracker lighters and innocent bystanders as well. This poster intends to call attention to the preventive measures, safety guidelines, and effective treatments to reduce the occurrence and severity of such injuries, ultimately improving public safety during festive events involving fireworks. In the methodology, we are going to talk about two patients. A 8-year-old male who presented with the complaints of redness and pain, and a 13-year-old male who presented with the complaints of loss of vision in right eye, redness, bleeding, and pain. In the first patient, he was hurt during a neighborhood firecracker display, and in the right eye, during examination, we found out that the visual acuity of the patient was counting fingers close to face, PL positive, PR accurate. There was edema in his lids, congestion in the conjunctiva. The cornea was stain positive. There were few epidefects. AC had a normal depth in the iris. There was iridodialysis at 7 to 10 o'clock position, right here. In the pupils were dilated and fixed, the lens was clear, and in the fundus there was a dull glow with hemorrhages over the disc and macula. The left eye was within normal limits. In the second patient, he was also hurt during a firework display and was also an innocent bystander. In the right eye, he presented with a vision of PL positive, PR inaccurate, lids were normal. There was congestion in the conjunctiva, and the cornea had a 10 to 12 mm full thickness corneal tear. The AC had total iphema. Iris we saw a uveal tissue prolapse. The pupil, lens, and fundus had no view. The left eye was WNL. This is the second case. We can see a 10 to 12 mm full thickness corneal tear, and there was uveal tissue prolapse as well. This patient presented with a vision of PL positive and PR inaccurate. In results, we can see that in the first patient and the second patient, we did a CT brain plus orbit, and the results were that in the first patient, there was a mild preseptal edema, and in the second patient, there was no evidence of intraocular foreign body, and a corneoscleral tear repair was done. And we started a topical management for both the patients. In the first patient, the patient was managed conservatively, and the second patient, after the tear repair, we managed the patient conservatively. In conclusion, I would like to say that firework-related ocular trauma is one of the major preventable causes of ocular morbidity and blindness in children and young adults in both active firecracker burners and innocent bystanders during festive season, and hence represents a significant public health concern. Understanding these unique challenges associated with ocular firecracker injuries is crucial for developing effective strategies to reduce the incidence and mitigate long-term visual consequences. Awareness among the masses, preventive measures, and strict implementation of government legislation may help in bringing down the incidence of firework-related ocular morbidity and blindness. This is the take-home message for fireworks safety. We can keep a bucket of water or garden hose nearby in case of fire. Wear safety goggles available in the optical shop. Never let children play with fireworks unless they are supervised by adults. And don't pick up fireworks after they have been lit. And notify any veterans in your neighborhood if fireworks are going to be used. And enjoy professional firework presentations and avoid doing them by yourself. If the eye has been damaged, we can follow these measures. It is important to not rub the eyes as it may worsen the injury. Do not apply pressure to the eye. Do not apply any ointments or pain medications by yourself. Do not remove any objects from the eye. These are my references. Thank you.
Thank you, Dr. Shruti. Nice presentation, and when the Deepavali is nearing to now. So, how the child later on presented, like, how was the fundus or was it seen on B scan? How was the follow-up?
Yes, ma'am. Ma'am, in the first patient, the child was pretty normal. After he came, the vision it came back to 6/12 parts, and after refraction,
The
it
posterior
came to.
segment was not involved.
No, ma'am. The posterior segment was not involved in the first patient. Ma'am, in the second patient also, the fundus was clear, but in the anterior segment, ma'am, there was corneal opacity. The vision came to counting fingers at 2 meters, ma'am. PL was positive, PR was inaccurate because it was in the
2 meter was the final vision.
Yes, ma'am.
Was the lens was injured? Anything?
Ma'am,
posterior
he
segment?
developed a traumatic cataract. We had to replace the IOL for the patient.
Fine. Thank you.